Welcome to the Hospital Finance Podcast, your go-to source for information and insights that can help you protect and enhance revenue at your hospital. And now, the host of the Hospital Finance Podcast, Michael Passanante.
Hi, this is Mike Passanante. Before we begin today's episode, I wanted to take a minute to thank Mike Marola and everyone at Winning Strategies Washington and the Princeton Public Affairs Group for hosting their annual post-election luncheon and facilitating the interviews you're about to hear. My colleague Tom Fogarty was on site and spoke with a few of the key figures at the event.
Welcome to the Hospital Finance Podcast. I'm Tom Fogarty from Bessler Consulting. Today's episode was taped at the 2016 post-election luncheon at the Trenton Country Club. I had the opportunity to interview two of today's panelists, Congressman Leonard Lance of New Jersey's District 7, and Matthew Hale, Professor of Political Science at Seton Hall University. I also had the opportunity to speak with Tom Bracken, who is President and CEO of New Jersey State Chamber of Commerce. I'm here with Congressman Leonard Lance. Thank you very much for taking some time to speak with us today. I appreciate it.
Thank you. It's my pleasure to be with you.
Okay. How do you think the new administration will change the Affordable Care Act?
I think that the new administration is looking to repeal and replace the Affordable Care Act. I don't favor going back to the situation that existed before its enactment, but I do think there has to be major modification, and I would imagine that would occur beginning in January.
Okay, great. Where do you believe the new administration and houses of Congress could improve the Affordable Care Act?
Costs have increased dramatically for Americans who have been covered, and so we want to make sure that that does not continue. I personally think that we have to repeal the medical device tax. It's critical to the congressional district I serve here in north central New Jersey. I also think we need tort reform, and we have to make sure that insurance companies are not bailed out by the tax-paying public.
Great. Do you think the new administration will continue to push for the movement for fee-for-service to fee-for-value payment models?
Yes, I think we're moving away from the old system into the new system, and I think that would be true no matter who had been elected president. And we need a new patient-centered model, and that, I think, is the wave of the future regarding health care in this country.
Okay. What do you think some of the biggest pressing issues for hospitals for the year 2017?
Hospitals have to make sure that they can be financially stable, and in many states, hospitals take patients regardless of their ability to pay. And so we have to work with hospitals to make sure that they perform the services that are essential for the better health of the American nation.
Okay, and in regards of healthcare policy, what would be some of the biggest issues in 2017?
We have to make healthcare more affordable in this country. This country spends 18% of gross domestic product on healthcare costs, far exceeding other industrialized countries around the globe. And we have to do a much better job to make sure that the American people receive the best care possible, but receive value for the services they receive. And this will continue to be an issue of discussion, particularly in the House Energy and Commerce Committee on which I serve, which is the committee of jurisdiction for the better health of the American nation.
Congressman Lance, thank you very much for your time. I appreciate it.
Thank you very much for having me.
Hi, I'm Matt Hale, and I'm a professor of political science and public affairs at Seton Hall University.
Thank you for coming on. How do you think the new administration will change the Affordable Care Act?
Well, the biggest thing they've said is that they're going to get rid of it, and that's a pretty big change. It's probably a little bit more complicated than just a stroke of the pen getting rid of it. There's a whole variety of different sub-bills and laws that would have to go through Congress, but I think that Donald Trump's been pretty clear that he wants to significantly decrease and get rid of the Affordable Care Act.
Okay. What do you think the biggest issues around healthcare policy will be in 2017?
Well, I think in 2017, how that all plays itself out, I think it's important to remember that the ACA has 20 million people who have insurance today that didn't have it before. What happens if that goes away? What happens to those people? Are they phased in, phased out? Will they be put into to a new system? And I think that may take up to a year for it to figure out where do those 20 million people go. A lot of those people don't have the ability to have insurance through their employer, and so I think that's going to be one of the primary issues.
Okay, great. Well, I appreciate your time. Thank you so much.
Thanks for having me.
All right. Okay, thanks for joining the podcast.
Sure.
Tom, can you give me your name and title, please?
Tom Bracken, President and CEO of the New Jersey State Chamber of Commerce.
Great. Thanks for joining us, Tom. Mm-hmm. How do you think the new administration will change the Affordable Care Act?
Well, I'm not sure exactly how they will, but they've made a lot of comments about the fact that they will. So I think the fact that they're addressing it is encouraging, because it's clear that what we have in place right now is not as effective as it should be, and I think you could probably argue that it's not working. So I think a lot of people are encouraged by the fact that they've been talking about this throughout the primary and throughout the election process, and something will get done.
Great. Where do you believe the new administration and houses of Congress could improve the Affordable Care Act?
Well, I think they have to look at what the original intention was, which was to provide better care at a lower cost and to cover more people. I'm not sure any of that has happened. So, if any one of those three is improved, it's an improvement, and hopefully all three will be improved.
What do you think are the most pressing issues hospitals will be dealing with in the upcoming year?
I think hospitals have a particular challenge, as evidenced by the fact that it's probably the industry that's consolidating the fastest. So that tells me that there is a real need to provide expanded care in some of these hospitals, probably a need to reduce some of the overhead costs, and probably a need to utilize empty beds in a more efficient way. I think they're facing a lot of challenges, and again, you don't have massive consolidation in an industry unless there are some systemic needs that need to be addressed, and my bet is that they have a lot of those needs, not the least of which is how they handle the cost of care, which goes right back to the Obamacare issue.
Mm-hmm. And do you think those related to the biggest issues that is concerning healthcare in 2017?
Well, the biggest issues are what we are hearing our members talk about, which is cost of health care continues to rise, the options for employees continues to shrink, the quality of care that they're getting in some cases is not as good. So none of those things are good, but when you put them all together, it's not a very encouraging situation, and that it has to be addressed.
Mm-hmm. Well, Tom, thank you for your time. I appreciate it very much.
Thank you.
Thank you.
Thanks,
Take
Tom.
care.
This concludes today's episode of the Hospital Finance Podcast. For show notes and additional resources to help you protect and enhance revenue at your hospital, visit Bessler.com/podcasts. The Hospital Finance Podcast is a production of Bessler Consulting.